We just finished treating Terry. Betty. Terry's sitting down. Terry's the husband. And we put foam under each side of her pelvis. And so this was to treat each ilia and in essence let them glide posteromedial. Another terminology is outflare. And so you can see a little bit of that white foam under the right pelvis. And we have it under both sides. She's lying on her stomach. So we did that. And then after 5 minutes, I came and put a piece of foam on her sacrum for comfort. And I just pushed into it very gently with about 15 pounds of force. And we did that for 5 minutes. And what I'll do is I'll rearrange the camera and then I'll show you her body's response to the treatment. So let me get a broader angle. Alrighty. So my belief is that a pattern like this that's pretty entrenched takes at least 10 minutes to restore normal mobility. But the good news is it's a one-time treatment. And so now I'm palpating sacrum and I'm palpating the PSIS and they are in the same plane. So sacrum appears to be more forward. I'm now loading the sacrum and I can spring it readily. I can see her heels move, so the force is going through the sacrum, through the SI, down the hip, down as far as her feet. Here's a superior glide. I can take up the slack now and I can push with very small force and I can see her whole body move. There's an inferior glide. So we've improved her motion throughout the pelvis. And we will then go on and reevaluate, and the sacrotuberous now gives a little bit. It should have a little bit of give. So we'll go on and evaluate the side-to-side asymmetry that still persists, and she could have the pattern we name right anterior ilium, or she may have a left posterior ilium. But for now, I just want to focus on demonstrating how the body changes in responding to treating this. So let me show you the upper back, and then we'll show you sternum, and then we will show you the upper cervical response. This is a pattern I discovered about 15 years ago, and I've never found someone that I could not make a correction with. And so it's not in the body of literature of sacroiliac joint dysfunction, except in my book, which is on Amazon. And of course, when I teach workshops, I teach it. But you can see now that I can't find that place of hypomobility. And then the rib is springing very nicely. Let's have you lie on your back. So the upper body of the sternum was rigid. I'm below the upper body, and now I'm on the upper body. And just to make sure, I'm now on the the manubrium. So now I'm going to test traction of her head and springing on the mastoid and springing on the C1 transverse process. So here is springing on the mastoid, and you can see her head rotates freely. Now I'm going to lift on each side of the mastoid, and she now side bends. I'm on the right side of C1, and now I'm on the left side of C1, and just with a small amount of force, I can induce movement. With traction, I can see her toes move up and down. So the force is translating through that joint, and it's so easy to lift your head up now, because that first joint is not compressed in hyperextension. So these were reflex phenomenon that we resolved by getting to the bottom of the pattern, what I call the denominator. And these were just the body's way of compensating. So let's have you get up and walk up and down the hall a couple of times and give me some feedback. And I'm ready. And your thoughts?
That's definitely different, although there's a little bit of a twinge over in here.
Okay, how is it different?
Just everything feels looser.
Does it?
Yes.
Good.
Yes, not as tensed up.
Nice. Do you want to sit on that chair and see if you're aware of any sitting difference?
Yeah, I don't think the muscles are as tight down through here.
Uh-huh. And you're pointing to your left thigh, the outside of the left thigh.
Right.
Yeah, good, good. Well, I feel like we're off to a good start, but we'll see what that side-to-side asymmetry is and treat whatever we find. So thanks very much.
Oh, thank you.